Evidence-based nursing practices is a problem-solving approach to clinical nursing practices where patient experiences, doctors' experiences, nursing experiences, and preferences are taken into account, as well as clinical studies and other things that have been proven to work well in hospitals or practices are taken into account and used in the workforce. So there's a ranking system ranking level A to level C that shows what practices may be the most credible and what may be not so credible but could still work in individual circumstances.
Case-controlled studies have an observational approach that compares subjects known to have disease or outcome with those who do not have the known disease or outcome. This can be prospective studies and retrospective studies. They have to deal with exposure being present and exposure being absent. With epidemiological studies, this one encompasses many of the other studies in order to have that better problem-solving approach associated with evidence-based practice. This one has non-experimental and experimental studies, and you can see the breakdown here. With qualitative and quantitative studies, these types of studies are both descriptive and word-based, such as like having symptoms, behaviors, cultures, and group dynamics. With qualitative studies, this one will answer your why questions. Quantitative studies answer the how much and the how many.
For Level B evidence-based nursing, we have 6 subcategories. The first one is going to be the well-designed control trials without randomization. So this type of study, there's no random assignment used. And this type of research doesn't have a strong internal validity because there's often bias and unclear criteria within the study. The next one is uncontrolled study. These are studies that do not control participant selections or interventions. So an example might be a group being studied because they were just readily available. And then the next one is clinical cohort studies, and this examines groups of people who have common characteristics or exposures to something, and then they're compared to the group that's not exposed to something.
Hi everyone, my name is Savannah and I will be talking about Level C of evidence-based nursing today. As we know, the goal of evidence-based nursing practice is to make the best possible decision as to how a patient should be cared for based on evidence. All of the following information I will state is not from my head, but from nurse.com and dictionary.com. The first thing I would like to talk about is consensus viewpoint and expert opinion, and this is essentially a study that obtains agreement about specific practices from all clinical experts on a review panel. And the second thing I want to talk about is meta-synthesis, and essentially this is analyzing facts and bringing together findings from different studies to form a conclusion. Lastly, I want to talk about level multi-level, and this essentially just uses more than one level of evidence as defined in the rating system to come to a conclusion.
Evidence-based nursing practice is important because it produces the most efficient and highest quality patient care. Evidence-based nursing practice combines a lot of nursing values such as innovation, inspiration, learning, and collaboration. These values help develop improved practices that help things run smoother and quicker. It is important to use a problem-solving approach to nursing practices because that makes it more likely to receive the intended outcome. Illogical care leads to unpredictable outcomes, which is never best for the patient. Changes in hospital procedures and practices have been made that have saved lives, such as sleeping babies on their backs instead of their stomachs. Sometimes practices are so old that no one thinks to change them, but that kind of innovative thinking is essential.